In this vignette, we explore ways to deal with an overconfident preceptee who acts outside the limits of their orientation. The vignette will discuss factors that contribute to overconfidence and present suggestions for effectively communicating with the preceptee or student in this situation. The learning outcomes we will explore include exploring the reasons for overconfidence in clinical learning and evaluating strategies for addressing concerns with effective feedback. This is Galilea, who is currently completing her second week on the unit as a new graduate. Galilea was also a student on this unit and worked as a clinical assistant last summer before graduating and joining the staff as a registered nurse. Mr. Johnson was admitted to room 201 for antibiotic therapy with gentamicin. A peak therapeutic level is due to be drawn 30 minutes after the conclusion of today's dose of antibiotics. The preceptor started the infusion and set the dose to run over 30 minutes, with the nurse preceptee observing the administration. The nurse preceptor returns to Mr. Johnson's room 30 minutes after the initiation of the antibiotic infusion to find the pump has been stopped and the antibiotic line disconnected from the patient. There are 20 mils of fluid remaining in the bag. Mr. Johnson states, "Your trainee nurse came in and disconnected me so I could go to the bathroom."
Galilea, I was just in room 201 to check in on Mr. Johnson, and I noticed that his IV pump was stopped and his line was disconnected. You know what happened with that?
Yeah, he needed to go to the restroom, so I disconnected the pump. It was beeping. I thought was going to help him get to the restroom more safely, so that's what I did.
Okay, I see. Yeah, according to your schedule, we don't really go over IV pumps until week 4, so that's not a skill we've reviewed together yet.
I was trained to do this as a CA. Plus, the nurses would let me do this all the time when I did work there. I didn't think you needed to be there with me for something so simple.
Think about ways this situation could be handled to address the behavior while maintaining a positive relationship and learning environment.
Well, I apologize if I'm making you feel like a student, and maybe I wasn't clear in my expectation that I need to be there with you when we do any skills that we haven't reviewed together yet. And so let's talk about that IV antibiotic a little bit. So when I went in, he still had about 20 mLs left to infuse. And so unfortunately, he didn't get the full dose. And since he had levels that needed to be drawn, well, we're going to have to delay those. So now we need to let the attending provider know. And I think it'd actually be a good experience for you to make that call.
I actually didn't know about the labs. I thought the antibiotics were done since the pump was beeping, and I'm afraid that the physician's going to yell at me since, I did make a mistake, and I'm not sure I feel too comfortable making that call.
I can understand why you're reluctant. I tell you what, though, I'll make the call this time, but I want you to listen carefully so that, you can make the call next time. Also, before the end of the day, let's review the drug guide for gentamicin so that you know why those therapeutic levels are going to be so important. Okay. It's also just really important that we let the attending team know about what's going on so that we have that best, plan of care going forward.
What are some potential issues that contributed to this event? In addition to the lack of understanding about antibiotic administration and timing, there are important communication factors to consider. In this instance, there may have been a lack of clarity in expectations regarding what the preceptee could and could not do. While not present in this situation, it's important to also avoid communicating a sense of arrogance or superiority on the part of the preceptor, or gossiping or ridiculing the preceptee about the incident. Think of how differently this situation would have been if any of these were used. What about the factors on the part of the preceptee that contributed to this event? All of these are factors that should be taken into consideration. In this instance, there are concerns about specific knowledge related to medication and skills. A preceptor should also be aware of potential issues, such as the preceptee wanting to impress the preceptor by going above and beyond. Learning how to take responsibility for errors or near misses is a difficult lesson for new nurses. Let's see how our preceptee can take all these factors into consideration moving forward.
So now that we've set some guidelines and, we understand like IV pumps and procedures, let's talk about how we communicate with each other. I realized that I could probably be a little bit more clear about my expectations, but I'm also picking up that you might be dealing with some stress. Is there anything specific you want to talk about?
Yeah, it's just, I didn't realize how much there was to do as a nurse until I started here. I'm feeling a little bit of stress in that regard since I'm having trouble managing my time, and the other nurses in my cohort really rely on me to answer questions since they know I work here. And so I'm just really afraid to make a mistake.
Thanks for sharing that. I'm hearing that you're dealing with a lot of stress, maybe making this transition, and that's totally understandable given everything that you got to learn. But going forward, I want you to come to me with any concerns that you might have, and we'll figure out a way to deal with your stress together, and really help you become a successful nurse.